Hi, I'm Dr. Jeff Williams, the owner of Creekstone Integrated Medical, and I want to welcome you to our clinic and give you an idea of what to expect because we know it can create a little bit of anxiety to go to a new clinic. First thing is that you're in the right place, and just know that we believe you should look forward to your visits to Creekstone, not survive them. We have several different providers in our clinic, and we all feel the same way. We do our best to create a positive environment for you while you get back to a normal, productive life. It's not just a talking point when we say that we treat our patients like our family. Our patients are a part of our family. And since you're now family, I want to be honest with you. Sometimes it actually can happen with short-term pain, but in general, those that are looking just for a quick pop that's going to get rid of weeks or months or years of pain, you're typically going to be disappointed. Pain can be weird and it can be difficult. If we could fix everybody in one visit, we'd be picking them up in buses down at the airport. I'd be rich and I'd be famous, and I'm just not. So most folks understand that pain is difficult and it can take time. I'll explain more on that in a few moments. But some key concepts you're going to hear from us are that movement is healing and motion is the lotion for the joints. And that goes for those that just woke up hurting, car wreck victims, veterans, which the VA pays for, by the way, those that got hurt at work, athletes, golfers, gym rats, and maybe just older folks that just aren't getting around as well as they'd like to get around. Think about after a serious surgery, for example. Patients are walking the hospital halls almost immediately because movement is healing. Most spinal pain is related to how and when a person moves. It's going to respond better to movement-related activities than it's going to respond to chemicals like pills or cortisone shots. In fact, if it hurts when you move, there's a real good chance that we can help it. When we talk about joints not moving so well, it can be like having bad neighbors that live right next door to each other. We try to fix it by restoring proper movement and proper muscle balance. And when we have bad neighbors in the joints, well, they can wear on each other unevenly or in an unhealthy way over time, which causes them to eventually start to make changes in the structure of the joint. And that's where we come in. Also, we get questions on this, so I want you to know, if we don't order x-rays on the first visit, don't be alarmed. We follow the national guideline, which is called Choosing Wisely, to tell us when to order imaging, and most patients just don't need them, at least in the beginning. If you don't respond well in the first 2 to 4 weeks, when we do our re-exam, then we'll absolutely be looking at getting some x-rays or MRIs or whatever we need to further evaluate. Let's talk about pain briefly. In general, pain relief usually happens fairly quickly when treating at Creekstone, and then we move into the strengthening phase to prevent it from coming back. However, pain that's lasting longer than 3 months is called chronic pain, and that can be more of a challenge. 3 months is the mark, and we can get there before we know it. We don't have a lot of time before pain turns chronic and harder to get rid of. Chronic pain, that type of pain can cause patients to step away from activities that they love to do, alter their interactions with physical activity or their jobs, and even alter their interactions with family members and friends. Well, this sort of thing leads to deconditioning, leads to a more sedentary life, a deepening of chronic pain, anxiety, depression, emotional swings, and sleep issues. Chronic pain is a big deal, but there's great news, right? We specialize in pain, no matter how long it's been around. And we specialize in getting patients back into their lives as quickly and as inexpensively as possible through evidence-based and patient-centered care. We use research and experience to guide our treatment and tailor it to your specific condition through a broad management protocol. You are fortunate enough to find yourself in the first and only clinic in the Texas Panhandle to offer medical services, chiropractic care, physical therapy type exercise, massage therapy, and acupuncture all under one roof. Now that saves you time, money, travel, and effort. All hands on deck with the single purpose of getting rid of your pain fast and efficiently. The American College of Physicians, the world's largest medical group, recommends first-line treatment for back pain of any duration be spinal manipulative therapy, exercise, massage, acupuncture, and cold laser, just to mention a few. And we offer all of those right here. In addition, medical services like trigger point injections, primary care, hormone balancing and testosterone replacement, IV therapy, medical weight loss, PRP joint injections, and much, much more. All of that is available here. Now, part of being a patient-centered clinic like we are here at Creekstone, it means never making recommendations to treat you for the purpose of making the clinic money. And more importantly, we will never scare you into coming to see us, and we'll never try to make you feel that you are dependent on us in some way. We want to make you feel better, and then we want to teach you how to stay that way on your own, without us. We follow national research-based guidelines for your treatment, which are similar to those recommended by a physical therapist. We're trying to change the musculoskeletal system, and that just typically takes a little bit of time and consistency. According to guidelines for long-standing chronic pain, that means about 2 to 3 times a week for up to 4 weeks before a re-exam, and then we'll look at your goals beyond that. For short-term pain, consistency is what matters, certainly in the first few weeks. The national guidelines tell us 3 times a week for up to 4 weeks, just for the pain relief part. And then we look at your goals going forward to try to prevent it from coming back. Now, remodeling the body, it's kind of like going to the gym. If you do it only once a week, yeah, you're going to get stronger, but it's going to take a good bit longer than 2 to 3 times a week, wouldn't you agree? At the end of those initial 3 to 4 weeks, we reevaluate your progress, adjust your treatment frequency based on how you're responding and what your goals are. We are normally able to get musculoskeletal injuries to heal in 3 to 6 weeks, but there can be things that slow that down as well. The first of those things is age, right? The older we are, the slower we recover, and that's just the facts. Just ask somebody that's beyond 45 years old or so. They can tell you all about it. We don't bounce back like we used to. Now, the second one that can cause longer recovery is the length of time the current symptoms have been going on. Long-time pain didn't get there overnight, and we're not fixing it overnight. The third issue is the number of previous times you've been hurt for this issue. For pain, the biggest predictor of future issues is previous issues. Now, the fourth reason is the intensity of the symptoms at the initial visit. When it's fired up like a bonfire, it may take some time to put the fire out. So all of these complications can predict a longer and more complicated course of care, up to 8 to 12 weeks sometimes. And the more of these issues you have, the longer you can reasonably expect it to take. Now, going forward, after today's visit, you'll see one of our chiropractors as well as work with our staff in our exercise room. They will work with you on improving your strength, movement, and your function while I work to improve your mobility and try to keep you from re-injuring yourself. Now, these things are key to getting you back to what you love to do and then manage any reoccurrences on your own without us. Pain can change a person and can change their relationships with everyone around them as well. But the good news is that we can change pain, and this only happens when we have buy-in and consistency from you, our patients. When we have a good teammate in our patient, we have an excellent opportunity to make it happen. To give us an even better chance of making it happen for you, we use a handy phone app that can help you track your pain journey and stay in touch with our providers through the app. Through tracking your case, we can have a good idea of what's going on and be more effective providers on our end while hopefully speeding the healing on your end. And we know that when we have a good teammate in the patient, for any and all conditions we see, the stats show us that we have about an 80% improvement rate and satisfaction rate. For things that are firmly in our wheelhouse, like back and neck pain and headaches, well, that number is significantly higher than that. Also, our patients are around 99% likely to refer their family and friends to our clinic for treatment. And what a compliment. Man, our goal is that you'll eventually want to do the same. Our patients commonly go to bed feeling better, wake up feeling better, get off of pain medications, and get back to their lives with a different level of activity that they were once afraid of. And that's huge. That's life-changing for them and their family and their productivity at work. And we see it happen every day for the right kind of patient. Before I forget, if you're active on social media, you just have to go like our Facebook page, Twitter, and Instagram, and subscribe to our YouTube channel. You'll find us on all of those under Creekstone Integrative Medical. We do educate here and there, but we also have a lot of fun on Facebook. Scare cams, funny posts, just about daily, and lots of personality. We also connect each week through an email to keep you updated on the clinic happenings, and I usually share some personal things like mine or my daughter's artwork, for example. So I'm serious when I say that our patients are family. We treat you like part of our family. So to wrap it up, the right decision can literally change everything, and we certainly think you've made the right decision by being here today. So let's get started. Thank you for taking the time to watch. One of our team members should be with you in just a moment.